The diabetes surgery trial just published its 5-year outcomes from a randomized controlled trial that was done in 4 different sites, both in the U.S. as well as abroad in Taiwan. The study was a follow-up analysis, 5-year analysis of a randomized controlled trial where 120 participants either received Roux-en-Y gastric bypass and intensive lifestyle therapy versus intensive lifestyle therapy alone. And the primary endpoint was to look at the rate of achieving a composite outcome of glycemic control, LDL levels, as well as blood pressure. And what they found at 5 years was that 23% of the participants who were randomized to surgery were able to achieve this triple composite endpoint as compared to only 4% who were in the non-surgical arm. And the study showed that at 5 years, that those that received Roux-en-Y gastric bypass had better control of their diabetes versus those who were in the non-surgical arm. So the importance of these findings for the clinical population is really tremendous, because there's so many patients who are overweight with diabetes, whose BMI is in between 30 to 40, and many of them are inadequately controlled with lifestyle and medications. And so this study pointed out that when patients receive Roux-en-Y gastric bypass surgery, even after 5 years, they have a better success rate of achieving diabetes control, both from a glycemic as well as a lipid and a blood pressure standpoint. And we hope that 5 years of better control will mean reducing the risk of complications, both macrovascular as well as microvascular. I would say the limitations of the study, actually there are several, because they only looked at the effects of gastric bypass. And we know that the sleeve gastrectomy is an up-and-coming bariatric procedure, and that procedure was not looked at. But we know that studies are showing that there's similar weight loss with the sleeve gastrectomy as well as gastric bypass. So that is one limitation. The other limitations was that the intensive lifestyle education was only administered for the first 2 years. So one wonders whether the outcomes may have been perhaps better if the intensive lifestyle education was extended for the 5-year time period. The follow-up also in the study was a limitation. Only 82% of the participants completed follow-up at 5 years. So clearly this does also diminish the results. And there were 9 patients who crossed over from the medical arm to the surgical arm, but the statistical analysis was intention to treat. So this also disrupts how we can interpret the data.